My name is Sean Thomas, and I did my internship at Nanchang University's School of Public Health in Nanchang, China. The School of Public Health at Nanchang University, founded in 2002, consists of a total of 5 departments and is made up of a total of 35 faculty members, which includes 10 full professors, 10 associate professors, and 3 distinguished professors from the U.S. Campus-wide, there are 150 grad students and 1,000 undergrad students. Health issue. Academic stress is perceived as pressure that may be derived from parents, classmates, teachers, or society in regard to a need for perfection in one's studies. There have been studies conducted showing that students raised in Asian countries are more susceptible to increased pressure and stress pertaining to educational career plans. Those students who do not do well are oftentimes riddled with guilt and feelings of worthlessness when they are not able to meet the expectations their family holds them to, which can lead to depression and potentially suicide. Public health significance. China has a population that is approximately 1.4 billion people, much greater than the U.S.'s 320 million people. China has one of the highest suicide rates in the world. According to the CDC, China's suicide rate is 22.2 suicides per 100,000, while the U.S.'s rate is 13.5 suicides per 100,000. The competitive atmosphere of the Chinese education system, as well as the pressure exhibited by others to perform well in school, is one of the main risk factors for poor mental health outcomes in Chinese students. Students normally attend classes during the weekdays from 7 a.m. to 6 p.m. at night, with additional study sessions from 7 to 9 p.m. at night. All of this studying is for the college entrance exam, a 2-day test that level 3 high school students take that defines the rest of their lives. Now for my project. The Youth Risk Behavior Survey was administered to a rural Chinese high school to level 1 and level 2 high school students to determine the prevalence of mental health outcomes such as depression and if there is a relationship between the exposure of academic stress from family, teachers, or classmates. My interprofessional project is a poster that features mental health wellness info and strategies that Chinese international students visiting UNR may find useful when trying to adjust to the new culture in the U.S. Outcomes. There are 1,672 surveys collected from Level 1 and Level 2 high school students attending Ziyang High School in Wuyuan County. Data from the surveys was entered into a database and imported into SAS. Basic summary statistics of findings are featured here. The prevalence of depression in this population was 23.3%, and students reported that they felt very high or high pressure, mostly from peers, followed by family, and then teachers. As for the 6 competencies fulfilled during the internship, the first competency, Planning Management 7, was fulfilled by assessing the population mental health needs of rural Chinese high school students by completing an in-depth literature review, designing 7 survey questions. To fill the second competency, Evidence-Based Approaches to Public Health 2, I utilized the WireBS survey composed of 79 questions. These surveys were then distributed on-site to Chinese students in Wuyuan County at Ziyang High School. To fulfill the third competency, Leadership 17, I collaborated with Chinese MPH students, UNR MPH students, and faculty to design culturally appropriate questions prior to the distribution of the surveys to narrow it down to 79 questions. To fill the fourth competency, Communication 19, when conducting the WireBSS in Wuyuan County, we communicated well with one another to distribute the surveys in a timely manner during study time. To fulfill the fifth competency, Interprofessional Practice 21, I completed a culturally and clinically appropriate mental health wellness poster by cooperating with a Chinese medical student and a teacher. To fulfill the sixth competency, Communication 20, I communicated with Chinese MPH students about the cultural relevancy of certain mental health questions in the WireBSS prior to including them into the survey. Overall, my internship experience was very insightful. I was able to work together with 2 other UNR students, Nanchang MPH students, my preceptor, and my faculty advisor during the administration of the WireBS in Wuyuan County. I was in close contact with Nanchang MPH students throughout the entire experience. Other days I explored the city with faculty. In addition, I networked with other students and employees at Nanchang CDC and discussed research in our cultures. Community impact. The Wuyuan WireBS project can have a great impact on the community. This was the second administration of the survey at this school, so future students from both Nanchang and UNR can collaborate and add to the existing data. In addition, the 10 UNR grad students, or the 10 grad students involved in the project, all have their own specific projects they're using the data from the WireBS to complete. Any manuscripts published as a result of our findings will show the merit of this research and hopefully reach the eyes of important community members to improve the health of the high school student population in Wuyuan, China. Special thanks to my faculty advisor, Dr. Wei Yang, Field Study Coordinator Gerald, my preceptor Dr. Yuan, UNR MPH interns Sergio and Bianca, the Nanchang University School of Public Health, and all the graduate students who worked with us. Thank you.